Hi, I'm Jack Cush, Executive Editor of Room Now. I'm here at RWCS meeting in Maui. This is a 9th annual meeting here, a good program, lots of interesting speakers, a lot of interaction between the faculty and the participants. Today I gave a lecture on vaccination, an update on vaccination for adults. We all know that vaccination is one of the major advances in this century as far as preventative health. It's often disparaged, there's often a lot of rumor, but the facts are very clear that it saves lives because of vaccination. There is no more measles and rubella, and a number of diseases have been wiped off the face of the earth because of vaccination. There still remain challenges, especially with regard to influenza and pneumovax and the use of live virus vaccines like the shingles vaccine, Zostavax. That is an important lesson for all of us. There have been guidelines on the shingles vaccine since 2011 from the CDC that say that such vaccines should not be used in individuals who are taking live viruses like the shingles vaccine. That if you do use them, you should be off of a biologic for 4 weeks and then restart it 2 weeks later after the vaccination. And that's a safe window for which the vaccine can then be effective. The other rules regarding virus vaccination, for instance, would include not using it during acute infections, not using it to treat acute zoster infections or post-herpetic neuralgia. It is indicated for a number of other immunosuppressed conditions as well, but there again the same rules do apply. Regarding influenza and pneumococcal vaccine, we do know that most of the current DMARD therapies and biologics have little effect on those, and you should encourage the use of those inactive or inactivated vaccines in patients who are receiving therapies. However, patients who are receiving rituximab will need to receive those vaccines prior to therapy because the responses have been very blunted in patients who have the B-cell antibody given. So vaccinating before rituximab is vitally important. It's also vitally important to vaccinate for zoster before someone receives tofacitinib, the JAK inhibitor, because it's been associated with a much higher rate of shingles infection. So again, there are good rules out there on safe use of vaccines. This should be encouraged. If you don't believe in the damage the infection can cause, you're not likely to believe in its cure, which is vaccination.